welcome back to the Healthcare Executive Insights podcast. My name is Elliot Sloan with the Macallan Group. Today, we are very excited to welcome our guest, Mr. David Downing, who is the CEO of Youth Eastside Services. David, thank you so much for taking time to chat with us today.
Elliot, thank you so much for having me on. I appreciate it a lot.
Yeah, it's our pleasure. So let's start with telling us about Youth Eastside Services and maybe a little bit about your professional background.
Yeah, Youth Eastside Services is a 50-plus year community-based mental health organization that serves the greater East Side of King County, which, just to give folks on a national level a sense, we're across the pond from Seattle. So we're the big metropolitan area that is not Seattle in our region. And we serve families with kids ages birth to 22, so birth to launch, and with a very strong focus on behavioral health, so mental health and substance use treatment. We annually serve about 5,000 children, youth, and families in different capacities, some of them more intensively and some of them with lighter intervention touches. We are the kind of cornerstone, really, of children and youth services here within our region. So we're really the designated entity for that. In terms of my background, I have worked in this sector for over 30 years. I am a licensed mental health clinician and basically worked my way up through different positions of running programs and the like, and ultimately into this position here as the CEO of Youth Eastside Services. So I really take serious my background and knowledge around being a clinician to know really how to really best guide the organization and to really lean into the folks that work for us here. We have an incredible team of around 100 people that do work throughout the greater region that we work within. Our services are very integrated into the community, which is one of the key things for me professionally. It's been a huge focus. So we're on site in schools and teen centers. In addition to that, we have 4 of our locations for young people to come to. So, and I'm a father, so I've been through and experienced some of the things that many of the families themselves have actually, they seek help for here. I've gone through some of those with my own kids, because if we're raising kids today, mental health is front and center, and we recognize it in a much, much different way. And the passion that brought me to this work is my own background and upbringing. So I had some of my own personal challenges as a young person growing up. And it's just a gift to be able to be part of a mission every day that I can come in and be part of making the world a better place with my team here.
Yeah, that's tremendous. Thanks for sharing that. And you certainly are providing a much needed service in the industry. I'm sure over your 30 years working in behavioral and mental health, you unfortunately have seen the number of adolescents and youth that have these issues is only climbing and growing in the wrong direction.
Yes, absolutely. Long before we actually had the impacts coming from COVID and lockdown and the kinds of additional impacts that we've seen with young people, we actually already were seeing anywhere between a 10 to 15% increase in behavioral health needs with young people. So we in Washington State have what's called the Healthy Youth Survey, and it's done with middle schoolers and high schoolers. And in that survey, it's self-report, and you can line up questions that go directly to mental health, substance use, suicidality. And before we actually went into 2020 and the entire experience with that, we already had the past 10, 12 years really seeing this spike and increase in mental health issues. And specifically, we really have seen an increase in anxiety and depression with young people. The environment that young people are growing up in today is a lot different. There's a lot of different kinds of pressures. Social media is definitely something that we hear from young people We have a youth council that I work with here, and consistently, even though the constellation of the young people that make up that group over time changes, they always say, when I say what's the biggest driver, and they say everything is just so incredibly competitive. Young people, of course, are doing college courses in high school, they're resume building. They have this belief in their head that they have to go to an Ivy League school to have a successful life. They believe that they need to be sitting up till 2 in the morning studying and doing their homework to be successful in the classes that they take. They believe that they've got to be engaged in all of these extracurricular activities to the nth degree. And this is kind of the culture that's built really around young people without intention by anybody. There's no intention from schools, there's not intentions from parents, but it is a real culture and it's a real change. And it's also reinforced amongst peers. So young people have a nature and amongst themselves, even in terms of working to have a level of competitiveness with it. And it's not really a place that's very healthy for them because they're aspiring to be something that in reality is not something that people can sustain in any kind of long-term sense. And nor is it a reality for them to be successful that they need to do that. And there's also the messages that, hey, you got to go to college to be successful, which is absolutely not true. There's lots of different routes for kids to be grown-ups that are successful in all kinds of industries and trades. And that culture really has been huge. And that stress and impact on young people has been so tremendously impactful to the point that it ends up being a clinical level need that they have to try to manage the anxiety and the depression that they really experience from all of that.
Sure, you said it, and I think is 100% true. There's so many factors nowadays with the young individuals, so many pressures, and access to information is just so readily available that just wasn't a thing when I was young and you were young and previous generations before us. Um, how much do you think smartphones and iPads and YouTube and social media is playing into the problem?
I believe it's a major problem because I like to use the term comparative psychology, where young people see things on social media and our social media presence that we put out there generally is our ideal. It's a picture book. We don't generally put out our most challenged experiences that we have in life. So young people see other people out there having these just perfect lives and everything's great for them. And it's not. People put out pretty pictures, nice stories. They don't put out when the terrible things are happening. Some people do, but by and large, it really puts out this idealized picture. And so there's this misperception that other people have these lives that are so incredibly perfect, and there's just is not. And they try to measure up to that. And that comparative psychology just really adds to the level of view that young people have of themselves, and they can't live up to it because it's not a realistic standard. And it's been significant in terms of how we see that comparative psychology. And kids can never turn off. They're always have access. So kids that at one time experienced bullying in school, they never get away from it. All of that happens on social media. There's so many aspects on social media where young people, they can't leave the school day and go to any kind of a protected environment because there's always something coming at them. There's always comparative coming at them, and there's bullying that comes through online all the time and all the different platforms. And it's hard as adults. We don't even know. They've got some little areas that they find on the internet that they communicate that, I mean, I don't even know. I'll hear about them sometimes from young people, and I'm like, how do you, what, where'd that come from? I mean, I have no idea, but, um, but they look for it and find that, and they're connected more than ever. And yet that connection is not always a deep and real connection. So, it is a real challenge.
Yeah, it's a fabricated reality, and
Yes.
it's really setting unfair expectations for what life is all about.
It absolutely does. I mean, I see it with adults, and
Sure.
we expect young people with the developing, brains to be able to actually take that in. And if you think about the fact that, you know, typically a young male's brain doesn't fully develop until the age of 25, right? So, you're talking about really very young brains trying to take this in, understand it, filter it through, and understand it in any kind of a true context, which is a pretty unrealistic expectation for us to have of young people.
Sure, sure. And I'm sure there's plenty of studies that can also point toward the chemical effects that all this consumption of content has, even in adults, let alone the damage it does to the adolescents. I know, in my house, um, when they get their hands on the iPad and get, 15 minutes on YouTube, they are sucked in and mesmerized, and it's scary to watch, to see how addicted they are to those screens. As a father, it concerns me. Am I doing the right thing, even giving them 15 minutes of YouTube every night or whatever the case may be? Knowing that, we're spiking their dopamine, I believe, by watching these videos, and then there's a void to fill when they cannot keep up with it.
Yeah, and I mean, I think this is the most challenging period in history to be a parent because there are so many things that they're unknowns. The social media, how much do you let your kids engage in social media and be online versus not? So, that's where all the young people are at. So do you restrict that and not let them be engaged in that social aspect? And yet, what is the healthy level for them to be doing that? And there's no really clear and set rules around it. Is it healthy? It's certainly not healthy for the brain to be turned on basically 24/7. I mean, most kids have access to their devices all the time. Some parents will set restrictions and take them at bedtime and those kinds of things. And that generally doesn't go very well either because young people tend to find ways around uh, when they want to access those things. And adolescents, of course, are in a place of looking to seek and to be grown-ups and have independence. And so it leads to conflict often between parents and young people. But I've also really learned over time in our work, you can restrict access. And if a young person wants to figure it out and find out, they're still going to have that. And we also know it's really disruptive of sleep. And sleep and REM sleep is hugely important for mental health. And so we've got young people up late studying. We've got young people up late on phones, and the lack of sleep is a huge aspect. It really impacts issues of anxiety and depression. REM sleep is so important for mental health for everybody.
Sure.
And young people really, really need to have that because by nature, young people need larger amounts of sleep than what we as adults do.
Sure. Yeah, they're growing in their sleep, they said.
Yeah, exactly. That's exactly right. Yeah.
So I'm sure we can build a whole episode around the impacts of devices on children, but let's pivot. Talk to me about why you think, as a society, for so long, we've overlooked the importance of behavioral and mental health, not only for adults, but for children.
If we look back in history, mental health has always carried with it a stigma as if someone who has challenges around mental health, behavioral health, that there's something intrinsically wrong with them. And of course, that's not true. We all have mental health and we all have physical health. And you can look at culture, movies, the kinds of ways that we use words in our society. We use terms like insane or crazy when those things really are just, they're not helpful. They embed things in such a way that really frame mental health in ways that's not healthy. And really talking about mental health and normalizing it is really one of the best things that we can do. And it's not about an individual and there's something inherently wrong with them because, again, we all have mental health. It just gets expressed differently. It's challenged in the same way that our physical health is challenged. But getting past that stigma is really something that's pretty significant to move past. Happily, I will say the younger generation does seem to be more open than other generations by history. So there is more of an acceptance of it. And the experience of COVID has definitely made a more openness and understanding of it because so many people themselves, adults and young people, experience periods of mental health that they had not before. But it really is that shame that comes with it. Even families that come for help, they often don't want other people to know. And it's that built-in stigma as if there's something wrong with their child or there's something wrong with their family. And of course, that just is simply not true. Mental health can be expressed positively through happiness and life satisfaction. And we're all on the line. There's always, there's something that can happen and we can move over that line really quickly. And that can really lead us to an episode of anxiety or depression, could lead us to crossing that line for help, looking for ways to really medicate that. And that's when we end up with young people turning to substances, which is, of course, incredibly alarming because the issues around substance use and the like is so dangerous currently because of the fact that they've regulated a lot of medications so well that they're out in the community now. We have fentanyl and the like and pills that are pressed by the drug dealers, and young people, when they think they're making calculated risks for an escape, away from their mental health, they can't make those same judgments. And not that I would ever encourage them to make those judgments, but it's made a really big change. We have a lot more overdoses and losses in general that we see in our community and nationwide really around it because young people are taking medications that are unregulated, and it's really become such a crisis, which most listeners probably have heard of fentanyl crisis that's been going on and the like, but in general, we have that. So it really is that stigma piece that has been so huge and inherently built. And you go back in time and you can look at early periods of human history and the kinds of responses that we've had around people who have mental health challenges. And it's always something where it's, okay, there's reasons for it. There's external reasons for that. But we inherently place it that there's something inherently wrong with an individual, which just simply is not true.
Yeah.
And we need to be able to have access and help in the same way that we do physical health, in an equal way, equal access. We need to have equal coverage. Those are all things that if we did those things and we actually got on the front end of helping young people learn different skills to how to do better self-regulation and the like, we wouldn't be in the same position that we are now. And I really believe that's a huge part of the crisis, is that we've bombarded young people with so many expectations and social media and the like, and young people have a less ability to self-regulate based on all that they have coming at them. So upstream and hitting that upstream part, acknowledging it, talking about mental health really allows us to get away from that stigma. And it's still there, but it keeps people from getting the help that they need. And I think it's easier to say something's wrong with somebody than accept the fact that there's larger societal ways that we need to change and look at things differently and make really pretty big cultural shifts.
Sure. Yeah, the drug overdose pandemic in itself is a pandemic and an absolute tragedy. Definitely exacerbated over the past few years. And it makes you think, why don't we as a society bring this into the classroom, bring this front and center in front of our children, right? We think about, when you're a kid in elementary school, you have physical fitness tests. You are trained on how quickly you can run a mile. You have to go to physical education every single day. Why don't we as a society connect the dots and say, if we're pushing our kids physically, we need to give them the tools to have a healthy mental status by teaching them breathing techniques when they're frustrated, teaching them the importance of journaling, teaching them the importance of feeding positivity to the subconscious mind. Like, there's so many things that we could start from a 5, 6, 7 year old level that will carry on with them for the rest of their life. And these are tools that, most adults don't even have. And it's such a missing part of life. I mean, it took me till I was 30 to realize there's a massive benefit to doing breathing exercises. Why every grown adult out there doesn't know this already is absolutely a failure on a society level.
Yeah, I absolutely agree. And getting on the upstream really and teaching those skills is really key in its core. There is more movement around having social emotional learning curriculums within the school systems here regionally, and we partner very deeply with the schools that that service area that we are within. And one of the things that countywide where we live at, we've engaged in universal mental health screening, and it's a project that started in middle school, and they've now expanded it into the high schools. And it's universal screen. It's a check-in. Every young person, the goal is every young person is to get at least one time a year a check-in through a screen that it's electronic. They go through the screen on their own. And when this was launched and we did a partnership with our schools, the question was, well, are kids really going to answer these questions honestly?
Sure.
And I'm like, well, yeah, I trust that kids are going to actually do that. And we found that they have done that.
If no one's looking over their shoulder.
No one's looking over their shoulder. Yes, if they score out in a way that shows that they have some really significant mental health issues, then they get connected with in the same day. They get a mental health assessment, they get a risk assessment. Or if they screen lower, but they still need help, there's still work that's done to connect with that child, to connect them in some way to some other kind of support that they may need, which could be something like maybe they need to be part of a mentoring program or the like. But it it's the most useful and impactful thing that I've seen actually change throughout my 30 plus years of working in the industry is this recognition that we need to screen kids in the same way we do for eyesight, for hearing, like
Sure.
we should be doing that. And the place that we catch kids most commonly, of course, are going to be in our schools. And so these partnerships with the schools and the ability to do that is vastly important. And it should be part of the culture as a norm. It should be a nationwide effort that, we are undertaking here in our region, here within our county. It is definitely something we really decided to invest in. And we're having really good outcomes with it, because the big challenge that we have is that young people now, they don't look the same as they did before. Yes, are there kids that you can look at and say, oh, wow, something doesn't look quite right with this young person. This young person needs help. But unfortunately, more and more young people they're able to really look okay on the outside. They have friends. They engage in positive activities. They can be in extracurricular activities. They could even be getting pretty decent grades in school. And yet inside, their mental health is not good and they're not doing well. And I'll sadly say that more young people have been lost to suicide that actually externally look like they're excelling and doing well than kids that we could look at and say, hey, let's get that kid some help. And that's where the universal screening, that kind of intervention is so incredibly important. That's the part that's the most frightening to me as somebody that's been doing this work for so many years, and other people that I talk to in the sector, is that we can't recognize it in the same way. Young people don't talk about when they need help, and then we end up having the most tragic outcome of untreated mental health, which, of course, our goal is zero suicide. That's our goal.
Yeah, I can imagine it gets more and more challenging, more kids flying under the radar. What do you think the percentages of public schools out there embracing this mental health assessment, just like a physical? I remember growing up as a kid, always having our physical assessment, seeing the school doc once a year. When is it going to be just as simple as that? Have your physical assessment on Tuesday, have your mental assessment on Wednesday.
I varies time, no doubt, across the country in terms of the acceptance of that. Here within our region, I would say we're pretty progressive around really moving towards this. And the fact that there's been the kind of losses that we've seen from young people, where the adults were quite surprised by so many of the young people that have been lost. And so the level of engagement and investment around that is definitely something that's very high, and it's impacting their ability to actually provide young people education. So it's become such a challenge for them within the school systems that they've had to shift and they've had to change. COVID definitely, and the impacts coming from that, highlighted it to a higher level extent. And in Washington State, the Office of Superintendent of Public Instruction started infusing more money out to the districts to be able to undertake projects, to actually be able to be doing work that's more on the front preventative end. But is it enough? I will say it's not enough, because the need that's coming into an organization like Youth Eastside Services and partner agencies, and I talk with other leaders of the other organizations on a regular basis. We have common spaces that we're in, and the need just outweighs the ability to respond. There's just not enough funding to hire enough staff to be able to respond to the crisis points that young people really are in. And the reimbursement that we get from all of the clinical reimbursement models is so incommensurate with what it actually cost us to do care, that it's like, we want to let's add 10 more staff. That'd be great. But the financial reality is that you lose money every time you do a service, because the reimbursement is so off par to what it actually costs to do service. And at the same time, our workforce has really shrunk. It's become much more challenging. So an organization like ours, we serve everybody regardless of ability to pay. And a private practice, of course, doesn't operate in that way. And we lose a lot of people from community mental health that go into the private practice workforce, where they're basically operating on a cash basis much of the time. They don't even contract with the insurance companies. So they set a fee, they get paid, their session's done, their work is done. But it really, the workforce issues are huge. We've got people that graduate from college, they have huge amounts of debt they want to pay. And then the acuity level of the work that you experience working in community mental health versus private practice can be really different, because in private practice, you get to choose who you're working with. And if you're somebody that has resources to pay for those services, you just have access in a really different capacity. And private practice groups don't generally tend to take on high acuity clients. They don't have the capacity and bandwidth. Whereas entities like us, we've got psychiatry, we've got case managers, we have master's level clinicians, and we have care teams. So we have teams of people working in that kind of a way. But we lose in this sector as a whole a lot of people to private practice, because the work is less intense and they can make more money, which makes sense. And a lot of people during the last several years during COVID, they themselves became mentally unwell and needed to do work that was less intense, because during COVID, the acuity level really spiked up in terms of just the sheer number of young people having issues that are really hard to treat. And that is not declining. So schools have opened, and we saw an improvement when the schools reopened here in terms of kids and their mental health. However, the increase in need has not gone down at all. With the world opening back up, we still have young people at these really excessive levels of needing help. So we really believe that we're going to have long-term impacts from the experience of COVID. Young people that may never have needed professional help now do, and many of them are going to need support for a very long period of time. Um, and then kids who never needed help, just they could have maybe managed it in the family, just not possible. And families have not
Yeah.
fared as well.
Sure.
Parents.
The mom and dad have their own set of mental issues that they're coping with. How are they going to be able to really give the child the attention they need?
Yes, absolutely. The issue around mental health and parent mental health has been really very dramatic. I mean, it's always been an issue, but during the last several years and the ongoing impact of that continues to be in place. And it is shown even in some of the more tragic outcomes. I mean, we have lost parents in the community to suicide. These are things that just, at one time in the industry, it wasn't that we were hearing about suicides on a regular basis. And that, of course, is the most tragic outcome of really untreated mental health. And sadly, now we, on a regular basis, know there's just a certain number of kids that we're going to lose. And there's parents that we know that we're going to lose. And that, that kind of reverberates, and it kids see that. They know what's going on. And a real change that we've seen is that young people see suicide as a solution to their mental health, which is an ironic. It's a change. It's not something that we used to see. I was just having a conversation with a young person the other day, and this young person said, "Well, I can respect that somebody might need to choose to do that as a solution to their mental health, but I can't respect that they don't leave a letter explaining why." And it was a really interesting conversation to me because it just reinforced to me how,
Fragile.
yeah, and how it is seen as a solution. And I had a convening that we did here with other providers and the hospitals, where the hospitals, of course, are incredibly overloaded in terms of their inpatient psychiatric beds, and they'd actually just decreased them here in our region. They're closing down a certain amount because they became so overwhelmed and they don't have the staffing to respond to it. But everybody started having this conversation about that young people see this as a solution to their mental health, which is something that by history we used to never see. So it's a trend that is a really unfortunate one, because of course that is not a solution to mental health. We have lots of solutions to behavioral health challenges, and we want young people to actually be able to access those, of course.
Yeah, it's horrifying to think about that these poor young adults or young children can get to that point where they think that's their only option. And it makes me outraged to know that the payers have had record years with profits over the past 3-4 years. They've made more money than they've ever made in their existence. While inflation is through the roof, the cost of staffing is through the roof.
Yeah.
The cost of just operating costs for any business through the roof. And they must see, these payers must see these massive spikes in suicides and mental health, and they must realize that they are a bottleneck in the system. What does it take for the payers to provide better access for mental health services? And why is there not massive community outrage that there's not being more resources and more reimbursements being offered to providers to give the communities the care they need?
Payers just simply need to pay more money, and they don't need the size of profits that they are actually sitting on. That is 100% true. They also need to pay for like indirects that are not just the time that a young person is in a room or with a family session, because best practice work really involves holistic work. And there's so much work, particularly when working with young people, that we engage with a coach, a teacher, other people that a young person is engaged with in the community. It may be working with another social service provider to get a young person engaged in, proactive or promotive of health, kinds of activities. And those things just are not paid for. It's, you get paid for that time that's a kid is with you in a room, and that simply is so not even close to what the cost of care, nor is the hourly rate. If you look at an hourly rate of reimbursement and then you add up what it is that it costs you to actually deliver that, pay a staff, pay the benefits, and all of the overhead that goes with that, it is just so incredibly incommensurate. Why is there not more of an outrage? I don't know. Sometimes, honestly, I feel like I go into meetings and I keep bringing these things up around advocacy meetings. I bring them to electeds, and I believe everybody wants to do the right thing. Yet in the end, we end up in the same position. And occasionally I feel like I just want to throw a tantrum in some of these meetings. Like, why are we not doing something more? Because I really don't want to come to work and learn that a young person died by suicide. And this week, we have a young person in our community that we've lost.
Wow.
And this is unfortunately something we just really, really never saw before. And it was really, like I said, it was about 10 to 12 years ago we started seeing a change. And then, of course, the experience of COVID only has made that even greater. And, this is very mission-oriented work. We're all here and we have a lot of passion about trying to make a change and difference. And there's just systems that don't run well, and they don't listen well to those of us that are actually on the front lines and can be better part of making solutions. And there just has to be more money infused into it. You need more money to make more change, and we need to do more money on the front end, upstream kinds of interventions with young people, simultaneous to flooding the system actually for the intervention aspect of it. Because right now, I mean, easily we could add 10 clinicians, and we do a lot of collaboration, and it's not really a competitiveness that we do. It's more about, okay, how do we actually collectively organize, and what places and spaces are we in, and what are your biggest strengths? And so we do a lot of collective and active work trying to respond to it, because it's not a competition. There is so much work out there. There is no way that anybody is going to not be able to sustain in terms of clients.
Yeah.
The issue of sustainability is the reimbursement model that we really have with that, and that lack of funding. And what that does is it creates, the need for higher levels of fundraising, and which is great. Partnerships with our donors is really important, and it's great community engagement. But the ideal really would be that our contracts cover full in cost, and that our private fundraising empowered us to actually increase services rather than coming up underneath and covering the cost that the payers are not already actually paying in full.
Yeah.
I always like to use this analogy. If our county here was going to have their infrastructure for IT redone, they're not going to put out a bid and get bids in that somebody's going to say, oh, we'll do this for 40% of the cost, and then go have private fundraisers pay for the other 60, right? It's not. No, would never happen. And so it's our industry is unique in that way. It's like, okay, we're going to pay you this amount of money, and we expect this amount of work, and then you all go out and you do the private fundraising. And again, private fundraising is great. It really would be best, though, that the private fundraising allows us to expand.
Yes.
Yes.
Not maintaining
right
business operations.
Yes. And every year we have to raise more money just to keep the base, and the status quo. Right. And I'm really, of course, I'm incredibly grateful to our private donors in our community that do that support.
Sure.
But what a gift it would be to be able to use that to grow, rather than it being to maintain and underwrite these contracts that simply don't pay for cost.
Sure, it shouldn't be a life vest. It should be more of a injection of resources to help more patients.
Absolutely should be. It absolutely should be. And we're going to continue to be in this mental health crisis that we were in pre-COVID. It was happening before. It's only bigger now. So we know we need more resources and we need more creative ways to figure out how to do that. So, for us, we're actually looking at doing an endowment campaign as an added rail because we do very vigorous annual fundraising. We maximize the revenue that we can earn, but of course, as we know, the payers are not paying what it costs for care. So, we're trying to look at strategies for ourselves. We've been around for 54 years and trying to how do we embed ourselves in a way to be the most agile and able to respond to the community without relying on the payers making changes. We keep asking for it. We're going to keep doing that. We keep doing a lot of advocacy work. We're connected with our legislature and the like. And our legislature did do some things around certain increases and reimbursement rates for our Medicaid clients and the like. We got some people that are really invested and they believe in it. But yet it's not enough money. And they'll tell you that themselves, that it's not, enough money. They know that it's not enough money. And Washington State has definitely become very key centric. You would think that in our state, I think people view us as a progressive state, and you would think that we would have more dollars and resources, but it's ironic because we actually, our systems, we have less. We have less beds, we have less inpatient treatment centers. We don't have the resources that some neighboring states do. So when people have money, they send their kids out of state to go to some of these treatment centers that we just simply don't have here, which is very disappointing. And it's also really a challenge for me when I see the fact that, it's great if you have resources to do that. But some of our highest need kids that we work with are Medicaid kids. They have so many factors in their families and lives that are really constricting to them, and they don't have that ability to access that kind of help.
Sure. And I would assume, and I'm sure it's safe to make this assumption, that 95 or more % of the community mental health facilities out there are in your same situation, where they have more patients than they could possibly facilitate, and they don't have the funds to really even service the immediate communities they're in.
That is absolutely true, and specific around some of the changes made more recently to the clinical reimbursement model. There actually have been multiple organizations that simply went out of business because they could not afford, because the model change actually resulted in significant decreases in the Medicaid reimbursements. So we have organizations that are embedded within their community, and community-based organizations are great because we are in our community. We know our community. We know the dynamics, right? We have the partnerships with the schools, and there's many that have gone out of business. So there's just less providers. And then there's some that just closed their book of business to behavioral health. So they're doing other work, but they closed the book of business to behavioral health. So at a time where the need is greater than ever, and no doubt is going to continue to be in that way, we just simply have less resources to do it. And that stress that it places on organizations trying to keep the doors open, trying to keep staff compensated at a right level so that they're able to actually show up and work in community mental health and be in an environment that's also sustainable for them. It's a misalignment. Yeah, it's a misalignment. It's a significant challenge. Amidst all that, I mean, it's great because the people do have a very mission oriented and positive approach and do a lot of good teamwork, and there's great things that are happening amidst all of it. But there's an undue level of stress that we just simply don't need to have added on top of all of that great work that's being done that would make it a more sustainable experience for the kind of greater whole of community mental health that we have going on in our region here.
Yeah, I can only imagine the, additional stresses for an organization just trying to keep the lights on while you're juggling all these patients that have, serious issues that need to be addressed. Kudos to you and your team, and you're doing God's work. And we wish there were more organizations out there like yours to serve the communities, but we know it really comes down to making ends meet. And it's a tragedy that that business model is not even visible for providers who went into mental and behavioral health thinking they want to help, they want to serve, and they want to have a comfortable living, but they can't even connect the dots and put the formula together to say, okay,
Yeah.
here's my road to the life that I envisioned when I was training to become a mental health provider. It's probably going to discourage a lot of people who went into mental health to find alternative career paths, which is the exact opposite of what we need right now. We need to incentivize more professionals to get involved, to become expert mental health and behavioral health professionals, to serve our youth, to serve our adults, and building into the DNA of our society that everyone needs it and it's a must-have. It's not an option or a luxury. It's not an amenity. It's everyone needs it, and here's how you get access to it. I'm going to leave you with this question. What do you think has to give? What's the next stone to overturn, or what has to happen for this to really have a 180 so we have a positive future, not such a dim, scary looking future for mental health? Does it take the government to get involved with creating laws for payers to back these services more, better reimbursements? Is it going to have to take a little bit of forcing the private industry?
I think it's a collective of answers, really. I think it is that there has to be some level of expectation about government payers, insurance payers, and what that reimbursement looks like, and that it's commensurate with the actual cost of care. And we have a movement that is happening here right now where we're looking to get legislation through our state legislature that requires that contracts be paid in full for true costs, and with an additional on top of that, I won't say it's a profit, but with an additional on top of that sustainability charge, so that we have an ability to not be kind of going, hand to mouth kind of survival, so that there's reserves in the bank for organizations and the like. We're gifted because we are strong financially, in the sense that we do have, monies that are invested. We have reserves. A lot of organizations don't have that. The maturity of our organization and work we've done over time has allowed that. But it really is a collective. There has to be some work and accountability around insurance companies paying at rates that are acceptable. Because again, as I was saying, like, people go into private practice and they won't contract with insurance companies. We want to serve everybody, and everybody can't. In community mental health that come here, they can't pay. So we have to have a reasonable rate. So it takes more work from government in terms of requiring private payers to actually pay correct levels of compensation for what it costs. And it means that the rates that we're getting reimbursed for from the government level are reasonable and at a commensurate rate as well. So it's that. And then, of course, the private community, our donors. It's going to take really all three of those and raising all boats.
Sure.
If the first two, if we could get really the payers and the government in line with paying for what it costs for us to actually do the work,
Huge.
that's a huge win. That's a huge win. And there is, as I said, that work that's being done, and that would really get us to a place of being able to do something that's different. And the funding isn't just about the intervention piece in terms of the treatment. It really is also really investing on the front end of this work and that upstream intervention work and getting kids skills early on so that we don't have so many kids coming downstream and having to spend all of that time and money in a way that is so hard to get because they actually have an ability to be more resilient. So
Preventative care.
preventative care, right? It really takes all of that together. I wish I could say that I thought there was a simple answer to it.
Oh, it's
but
complex.
but I think it's this multi really pronged approach to being able to do that. And with that, I think that we also have to figure out how we empower parents with their own mental health and strengthen parents in knowing how to support young people and growing just adults in general about how to support young people, because not all young people are going to get to professional help. And I think that the better that we become as a society of getting rid of the stigma and people having skills to know how to support young people's mental health, that's also a really important aspect of the work, and making it so that this gets to a better place.
Sure. Yeah, I agree with all your points there. And the reality is there's just so much work to be done. But hopefully, as a society, as a whole, as a country, we can all wake up and realize that if we don't make the investments and the changes now, it only snowballs in a very, very bad direction. So now's the time, and maybe it was a silver lining of the pandemic. It shined a bright light on mental and behavioral health, and at least now people are talking about it. And thank you so much for coming on the show today. This is really our goal, is to open up these conversations and to get more people to be thinking about what they can do in their immediate communities, voting for the right legislators, and really getting their schools and their communities involved in being preventative with mental health from early ages all the way up to adults. This is all hands on deck, or else it's never going to come together.
Yes, and the more that every individual can learn how to talk to young people and check in with young people, whether it be a neighbor or whoever in a young person's life, the better.
Absolutely.
All of us have a role in checking in with young people, and it's not that heavy of a lift to figure out how you can check in with young people. There's lots of options and avenues for people to even take simple classes that they can gain skills if they feel uncomfortable with it. So it's all hands on deck.
Yeah, absolutely. Great point, David. We'll leave it with that point to our audiences. Don't assume, don't let the child go under the radar. Ask the questions, have the conversations. It doesn't hurt to spend a couple of minutes chatting with the young people in your life to make sure that nobody's flying under the radar who really needs help.
Absolutely. Absolutely. Because we never know who's flying under the radar. We need to check. Yeah.
Well, again, thanks for all the work that you and your team are doing over at Youth Eastside Services, David. It was a real pleasure chatting. And I know this message in this episode will really resonate with our audience. And hopefully we can all work together to move the needle in the right direction.
Absolutely. Thank you. I really appreciate the opportunity, Elliot, to be on here and talk about all of these really incredibly important things. So thank you.
It was our pleasure. Have a wonderful day.
Yeah, you too.